and before I introduce the minister, I would like to acknowledge the request on the Zoom that we will be taking a recording of today's session just for reporting purposes, and we hope that you agree with that. And so we would have the Honorable Minister who is joining us today, and it's an honor to have you, sir, with us today to share your perspective on Fiji civil society success and challenges, in particular influencing Fiji humanitarian system over the last 5 years. And then we would have the director of NDMO to share her perspective. We will also have Ratu Josefa from Plain International, as well as Wani from FCOS. We have the two respondents from our civil society, one from Empower Fiji, Empower Pacific, and we also have a member from our DCOS family. We also have another Wani from the West that is going also to be part of the speaker today. So that's how the flow of our session today. And I would like to take this opportunity to welcome our Minister for Agriculture, Rural and Maritime Development and National Disaster Management, Honorable Minister Inia Seri Ratu. There is a lot of information to share about the achievement of your achievements, sir. But maybe I could just want to highlight your contributions really to COP23, and I think that has been something that I find quite interesting in terms of the leading role that you had played around preparing communities, enhancing the resilience of the impact of natural disaster, which was occurring with greater intensity due to the climate change. And so you had brought that perspective of working in the community to the policy space. And I think that is one of the things that I would like to highlight in terms of how we as civil society recognize that your experiences working in the public sector at the same time looking into your role in the local government commissioners of Fiji Northern Divisions. Those experiences has really brought to light your understanding of civil society work, of which we have seen that value adding to our work. And with that, sir, we thank you for your availing your time to be with us. And I also recognize that some of the work that that FCOS have been able to do with the civil society in Fiji and the TCOSs at the subnational level has been guided by your leadership in this ministry. And with that, we really thank you for all that political will that you had put into the partnership with civil society in the humanitarian space. With that, sir, I would like to invite you to please say our opening address, but at the same time to share your perspective on how civil society work engaging with your ministry and the broader civil society humanitarian space. Vinaka, sir.
Naka, thank you so much. The Executive Director of Fiji Council of Social Services, Ms. Vani Ratnasinha, and the Executive Director of the Pacific Island Association of NGOs, Ms. Emmeline Shelley, friends and colleagues from Plan International, Child Fund Australia, and Fiji, civil society organizations, ladies and gentlemen. Firstly, thank you for the invitation, and my sincere apology for the very last minute response. In fact, I have seen the email, but because of other commitments, I forgot to respond. And just last night, I knew that something was pending, and I went through the emails again. So my sincere apology if I had caused some panic to the group, but I'm always passionate about engagement with friends and partners, particularly in the humanitarian space. And on that note, let me acknowledge all of you, our friends and partners, and of course, particularly and civil society organizations in Fiji. We have progressed significantly, but I understand the challenges that are there, and some of these challenges, unfortunately, are beyond us, but it doesn't mean that cannot be addressed. And again, let me make my commitment to you, Vani, and the team, as I've made in the council meeting on Monday, that I want this sorted out quickly between now and October, so that we can continue to make some progress. So again, a big acknowledgement. I thank you all for your hard work, your support, your cooperation, your advice, not only during natural disasters, but again, we have this pandemic as well. And we know the challenges that we also face during this pandemic. So it's an honor to be part of this webinar to promote the localization in the humanitarian space. Again, platforms such as this ensures effective response, better coordination, and leverage lessons learned for our improvement into the future. I know that Director NDMO Basiti will be with you throughout. I hope I can come in between now and then, because I have another meeting as well. Because as a referee for one of the posts in the region, I'm required to provide some reference as well for one of your Fijian colleagues who is applying for a regional job. So I'll be shuttling between the two virtual meetings. Hopefully, I can contribute if also needed, but Pasiti is there for you. But it's great to hear the previous dialogue. I read with interest. I've got your leaflet as well, or whatever you call it, Vani. I'm following that very closely, but good to hear about the previous dialogue and the experiences of CSOs, both internationally and national, together with our with our community organizations, addressing most of the critical issues around the national humanitarian system. And for your information, I've also, in trying to align with the national humanitarian principles that was agreed in the UNGA in 1991, I'm also liaising with ICRC because that is the mother document, perhaps for all of us. And as I've stated on Monday, Vani and the team, I want us to align to that and ensure that our humanitarian principles and the review of the Fiji humanitarian policy is consistent with those. So, but thank you for the feedback, and I follow that very closely, be assured. Again, this is an example of the localization, which is one of the outcome of the Grand Bargain Agreement that aims to improve humanitarian systems and promotes community resilience. Ladies and gentlemen, let me take us back to the World Humanitarian Summit in 2016 that was held in Istanbul, and this was immediately after Cyclone Winston. I remember I was part of the regional team. First, we went to Bangkok, and then from Bangkok, we went to Istanbul in Turkey for the World Humanitarian Summit. For the Fiji government, this is perhaps based on the lessons learned. This is the big shift that we made, particularly in terms of our development and looking at resilience and sustainability in the long term. So the key document that we took to both Bangkok and then to Istanbul was Fiji's transforming towards resilience agenda, if I may call it, transforming towards resilience. And as we speak, UNDP is with us. We are working on a strategic development plan, and that focuses on governance for resilience. But this is the journey that we took since 2016 after learning from Winston. It's changing the way we do things. And I think the key messages in one of those documents that we presented in Bangkok and in Istanbul was the way we live is changing, and it will continue to change. Now we have the pandemic, we have climate change, we have disasters and so forth. And therefore, because the way we live is changing, then the way we do development must also change. Let's not do development just for the sake of doing development. And this is where the partnership becomes so important, because we as developing countries must also ensure that our priorities are recognized by our friends and partners, so that we can work together towards those, and not according to what they think is good for us. And of course, the other issue is the way we do partnership. So in that transforming towards resilience agenda, the way we live is changing, the way we do development must change, therefore. And of course, the way we do partnership. And this partnership, Vani and the team, and friends and partners, is something that we still need to work on. The environment has changed. Some of the legislations that we have are archaic, and we need to modernize this. For Fiji, for instance, we are doing quite well in humanitarian work when it comes to disaster management, because the Act of 1998 clearly spells out that connection in terms of policy. But I think from Ministry of Defense and National Security, for my second head, that's something that we are working on now. All crisis or all hazards crisis management approach, rather than just natural disasters. But now we have the pandemic and the others. So these are the things that we need to address in terms of the way we do partnership. But probably I'll come back to this. But let me just say that in that 2016, our national humanitarian policy came into being, that institutionalized humanitarian practices, but then we need to do some improvement on that document. And of course, the National Disaster Risk Reduction Policy, that's also very, very critical for us. Let's not just focus on the response and the rehabilitation phase, but there's a lot that we can do in terms of preparedness and preparation. And probably that's something that I will also include as sort of a challenge for all of us when it comes to continuity in humanitarian work. I'll come back to that later on, Vani. I hope I'll have to stick within my timing as well. Let me just say a few more things. Let me just assure you that as Minister responsible for disaster management, I've taken all the necessary arrangements and given my instructions to the National Disaster Management Office for the review of Fiji's humanitarian policy, because we need a robust policy that is inclusive of all humanitarian principles and of course addressing emerging issues as well. As I've stated, we are doing well, but there's a lot of things that we need to perhaps improve so that we can bring efficiency into the whole humanitarian work that we are doing. There has been a lot since 2016. Let me just highlight that in 2019, we have assisted or worked with FCOS and Piango to launch the localization in Fiji research, which attempted to track the progress of localization in the country. In the same year, NDMO launched the CSO Directory and Protocol for Subnational Humanitarian Coordination, which was a guide developed by FCOS with the support of Child Fund Australia to help CSOs working at the subnational level coordinate their response efforts with their government counterparts. 2020, FCOS started work on a Fiji CSO Humanitarian Code of Conduct and the National CSO Humanitarian Reporting Form after consulting its members at the sub-national level. It later partnered with UNOCHA and NDMO to look at synergies on the coordination and reporting, and conducted additional consultations with international NGOs and national NGOs on these emerging policy areas. And lately, 2021, and of course, we have officially endorsed this in the council meeting on Monday, is the coordination or the support system in the full engagement and participation to national responses to foster the complementarity in Fiji's DSMAC system. So there has been a lot of examples that are listed in terms of our working relationships within the clusters and alongside commissioners, the ROCOs, the PAs, and the DOs, and of course, the CSOs also focus beyond response and surge support, also into research around global commitments such as the Grand Bargain Agreement, SDGs, the Big Tower, and so forth. I will not go into detail on those, but of course, I've mentioned about the first aid manual that was launched on Monday. Thank you to Empower Pacific, ADRA, and Chandu, and Plan International, which was made possible through the Australian humanitarian partnerships. Let me just conclude at this juncture to convey my sincere appreciation once again to the CSOs in their continuous support and commitments towards humanitarian actions in Fiji. Behind the many milestones that we have achieved, of course, we also acknowledge that there are challenges that we need to overcome. I'll just talk on a few very quickly. One is the laws and regulations that we have. We have some old laws, and that restricts us to some extent in the way we do things. And these are the things that we need to address, and we will coordinate with FCOS and our other agencies in a series of meetings so that we can get this addressed. I've talked about all hazards crisis management approach, and there are two core principles of all hazards management approach that perhaps I see as also a challenge for us in terms of humanitarian work that I would like to perhaps leave you with today. One is on continuity. Continuity in the sense that if this can be grounded, the crisis management framework approach can be grounded in the existing functions of organizations. From me personally, I see that some organizations focus only on the response phase and some maybe on the rehab phase, but there's a lot that we can do pre-crisis, particularly in the area of preparation and prevention. So within that approach, that's the continuity I'm talking about in terms of principles of all hazards crisis management. I know that we can do a lot to influence the behavior and of course minimize the risks and costs as well, if we can also pay a lot of attention on the preparation, and that's the continuity I'm talking about here. And perhaps coordination as well. When I'm talking about coordination, I think we still have some challenges in terms of the compartmentalization that does not allow us to share information. So this is the effective coordination and communication that will facilitate information sharing. I think that's what I'm meaning when I want to talk about the challenges. And perhaps lastly, It's just on competitiveness versus complementarity. I need to say that again because of some of the experiences in the past. Let's all look at the common good and, of course, ensure that we all work towards this. And this is why I also intend to look at the Fiji humanitarian policy. So don't want to bore you with a lot of other information at this stage, but let me assure you I'm always available. If my guidance or suggestions are needed, please let me know directly either through mail, but of course, I've got my staff working behind you, headed by Vasiti and the team. So again, I'd like to stress the importance of utilizing the existing systems, but these systems are there not only for now, but for the future generations as well. And I urge us that we have systems in place that will be meaningful to the partnerships, and of course, ensure that collaboration and the outcomes from joint activities are sustained for all Fijians. And I hope that this can be replicated into our other partner organizations and, of course, into the region as well. Again, I emphasize our responsibilities, not only as individuals, but as organizations and as communities as well, because we are very important to our states or to our nation. Therefore, I just wish all of you the very best in your dialogue and deliberations today. And again, my sincere apology if I will be shuttling between the two meetings today. But thank you very much, ladies and gentlemen. Binawalew.
Honorable Minister, thank you for those key messages. If I can just state two key messages that come out strongly for me was your sharing on the World Humanitarian Summit that is just happened after Winston in 2016. And I think what comes out strongly for me was the fact that the learning from our crisis often lead to shift in our way of thinking. And you have alluded to how that experiences have really shifted to Fiji, transforming towards a resilient agenda. The other point that you alluded to strongly was to ensure that we reflect on our existing systems and we have the opportunity to revise, reflect, see what is not working. And we are hoping that that what we are doing now today is that conversation is to lead to that, to understanding where we are now and where we would like to see the changes that need to happen. In addition to that, thank you for highlighting some of the policy directions that you have helped civil society, of course, to take a lead in bringing some of those policy papers to the space of humanitarian sector to help guide the work that we are doing. With that, Honorable Minister, thank you for having the time and sharing your experiences and your insightful perspective. We would understand that you may not have the time to be with us all throughout, but please take your time to join your other meeting, as we understand that your time is having so many competing priorities. With that, I would like to introduce our next speaker, Ms. Vasiti Soko, the Director of NDMO. Vasiti is no stranger to humanitarian space. And what I would like to highlight that she is one of the first female director to take up the role of the Director National Disaster Management Office. It's a huge undertake, particularly when you have to manage yourself coordinating civil society and government and other donors, international NGOs, that on its own is a really a hard task to take. But we have seen you playing that role in such a way that we have seen the emerging of civil society partnership, as the Honourable Minister had made reference to. With that, I would like to ask Vasiti if she could share. I'll give you 5 to 7 minutes to please share your perspective on the issue of coordinations, particularly in the role that you play, EFCO's role in terms of coordinations from a civil society, and to share your perspective, what has been the success and what have been the challenges that you have faced in trying to navigate your way through the humanitarian action and humanitarian sector. Vinakavasiti.
Thank you, Sale, and thank you, Director. Of course, I wasn't expecting to talk. However, again, classic example by Vani being brought to the spotlight. I'm not going to hesitate, but willingly share a few lessons learned from the coordination role. As you probably, most of us here at the humanitarian space, when COVID happened, were probably asking, why wasn't India more taking the lead role? And now and again, we've always been informing the team that even though we are not seeing at the front line, we are working behind Ministry of Health to support them in the coordination of the COVID-19 response. One of the main reasons why that is not falling under our mandate is because of our act. And as you heard from the Honourable Minister himself, our act, which is currently outdated, mandates us to look after natural disaster. However, it doesn't stop us from supporting other key ministries with regards to their response. And for the past COVID, or in the past couple of months, we have been supporting Ministry of Health with regards to the COVID response. One of the initiatives that we are currently heavily influencing is the whole of government approach on community engagement. We have been working very closely with UN Mocha on the establishment of the different dashboards, and we've managed to identify vulnerable communities, vulnerable populations that we've, and again, using our reach and our network, we've been able to share data. And this is something, again, the Honourable Minister specifically placed on the table for us to discuss the importance of data sharing. And we have been sharing our data with regards to those individuals that have lost their jobs due to the impact of COVID, those that are needing siblings, students who need worksheets. We've been sharing it with the key stakeholders. We've been sharing this information with our key ministries, and assistance have been pushed across to these communities, these individuals who are in need. Every now and again, we receive the team that are on the ground have been sending us needs from the ground. For example, a person living with disability requesting food ration. And surprisingly, it just takes one email to send to our contact to mobilize that assistance. And I've never been disappointed. I'd like to stress the importance of keeping our network together and keeping our network alive, because it is through the network that collectively we will be able to achieve what is set out for us under the humanitarian dana. So all the requests that have been coming in from disability, from our vulnerable members of society, we've been able to assist them through the very same network that we are promoting here, making this dialogue such as this very critical, very important, where we share lessons learned, where we share information as well as knowledge on how best we can collectively work together for the common good. And for us, the common good is our community. How best we can support them, that we don't duplicate the system, but at the same time reach out to the many. So we probably all have seen our media release that the National Disaster Management Council has convened. And in that meeting, as alluded by the Honourable Minister, the council members have endorsed this first psychological first aid training manual. And this is a lesson learned from TC Winston. So we've taken one of the lessons learned, we've enacted it, and through, again, a very effective collaboration through key stakeholders, we've managed to consolidate and launch and submit the first for Fiji psychological first aid training manual to the council on Monday, and the council members have endorsed that particular manual. Further to that, we are now 2 months away from the start of the cyclone season. For us, that is our Christmas, as we build towards preparing our community for the upcoming disaster that may or may not happen. However, as alluded by the Honourable Minister, preparation is the key. And I would like to conclude by encouraging each and every one of us about building bridges. Please, let's continue to work together. Let's continue to share lessons, and most importantly, let's continue to work for the common good for the people of Fiji and the Pacific. With that being said, thank you very much. And I will be here throughout the forum. Should any question, I'll be happy to take.
Thank you very much, Vasiti, and thank you always for accepting our last minute invitations. Often it's just like the odd hours in the morning, but we always appreciate your support. You bring out a lot of interesting points that I would like our speakers to elaborate a little bit more around that, particularly when you're talking about data sharing. In one of the things that we had also recognized, the vulnerability of populations is one of the key area of your talking points. And so we have also looked into making sure that accountability of our work to our affected population is key in terms of preparing for responses. As you also referenced to keeping our network close, making sure that we are building bridges, and it's easier said than done, building relationship. But I think that we have seen that you are inspired to move forward with bringing civil society to the table to find solutions for a better response to our communities. Thank you very much, Vasiti. I would like to introduce our next speaker, which is also not new to this space. Ratu Josepha Lalabalavu, the Plain International Fiji, a part of the Australian Humanitarian Partnership as the coordinator in Fiji. I would like to give a bit of time, 8 minutes to Ratu Josepha to please speak to the key AHP partners undertaking the localization, humanitarian localizations, but particularly looking into how the kind of support that you have seen through the consortium of the AHP, but also through the work of the Plain International in looking into harnessing the support for local partners, building the accountability to affected populations. So over to you, Ratu Josepha.
First of all, to the Honorable Minister Ratu, Madam Director, NDMO, to the Executive Director, FCOS, fellow panelists, and of course, the Executive Director of Piango, Bulavinaka, and welcome. And most especially to our participants joining in today's webinar. It's a great opportunity to convene and discuss humanitarian actions related to localization. And so, Bulavinaka, and welcome. On that question, Siale, it's a great question. And in order for me to answer that question adequately with the given time, I might need to set the context and really backtrack to the overview of the Pacific region. And so the Asia Pacific region is one of the most disaster-prone regions in the world. Tropical cyclones, tsunamis, floods, droughts, and other natural disasters that cause death and injury, damage to infrastructure, and then destroy livelihood support. So in addition to this, they cause secondary crises, such as disease outbreaks, cut access to education and basic health services, curb economic growth, and then contribute to the insecurities in our region. So what we as INGOs and then local NGOs have done in this space. Plan International, amongst other reputable NGOs here in Fiji and across the region, has had a great record in providing humanitarian assistance that helps save lives and assist affected communities get back on their feet, now more than ever, responding to the COVID-19 pandemic. I'm pleased to actually highlight an example, which you had alluded to, Siale, where the Australian government are working with the Australian NGOs to enhance disaster preparedness and response through the Australian Humanitarian Partnership. And so the partnership works with 6 INGOs based in Australia, and they're able to connect with their local counterparts or their local partners in each of the AHP countries, here in Fiji, Solomon Islands, PNG, Vanuatu, and on the borders of the Pacific, Timor-Leste. And so here in the Pacific, as an international NGO, we're able to action our preparedness and response support by working directly with local partners, ensuring proper alignment to government priorities at the national level and at the subnational level, so that affected communities are better able to respond to natural disasters. Speaking on localization, for instance, in the wake of TC Herald in March, April last year, the Australian humanitarian partners received a total of $1 million Australian dollars to provide response and then recovery support to the affected communities here in Fiji. Out of that $1 million Australian dollars, 79% of this total funding was channeled towards the local partners in Fiji, focusing on immediate response activities to medium to longer term recoveries in the areas of agriculture and livelihood, WASH promotion, and then psychosocial support. And I'd really like to also echo the same comments made by the Director NDMO in keeping the network alive. Through the experience of TC Herald, and then later into 2020, TC Yasa, and in early 2021, TC Ana, keeping the network alive was really the go-to when ANGO partners link with the local partners, and then more importantly, understanding the local systems to be able to better provide an informed support. Okay, so building on that, the NGO's extensive networks and humanitarian experience, the AHP support to the Pacific nation has been more resilient to disasters, so that affected communities can quickly rebuild and return to normal, so to speak. Yeah? One of the few examples that I'd like to channel into this is really our ability as NGO partners, AHP partners here in Fiji, to better manage disasters. Now, there's a contrasting difference between what happened in the wake of Tropical Cyclone Winston back in February 2016, a Category 5 cyclone, and TC Herald, which occurred in April last year, a Category 4 tropical cyclone. There was an influx of humanitarian INGOs that surged into Fiji during TC Winston. It, in more ways than one, sort of created a lot of disarray and confusion, understanding the local humanitarian systems, and comparing that with TC Herald, it was really more coordinated. And then now with with COVID-19 pandemic, country offices, local partners really had to step up and then elevate their capabilities to be able to support the government and the affected communities, simply because the borders were closed, right? So linking this back to the introductory remarks made by Honorable Seri Ratu on reflecting on existing systems, such as information sharing and then complementarity, and really looking at the common good. One of the key examples in addressing that was the AHP partners understanding the need at the community level, and then also identifying the gaps that were there in terms of response. We directed our focus and energy in communicating with the respective commissioners. So for TC Herald, it was with the Commissioner Eastern and Commissioner Central, right? And then really understanding what assistance is there already for us to ensure that there's no duplication of support, and then linking that to the assistance that we can provide through DFAT support, right? More than ever, being able to also coordinate effectively with the Fiji Council of Social Services and its respective district council of social services. It was, it took time to nurture, but it has grown to fruition, because now we understand the do's and don'ts. Now we understand what we really need to contribute towards, because it all aggregates at the I believe at the National Disaster Management Office level, in terms of the information dashboard and then so forth, and also connecting with the respective national emergency clusters, both nationally and the regional emergency clusters that's being chaired by UN agencies. So overall, Siale, our ability to be able to make informed decision is critically the underlying fact of our ability to knock on the right door, make the right connections, and being able to stay in touch with the needs on the ground. Because as ANGO partners, as NGOs, particularly now with the prolonged COVID-19 lockdown, we tend to lose focus from what the communities are experiencing outside the containment zones, right? With the tropical cyclones looming ever so closely, the tropical cyclone seasons looming so close, it's high time and mighty now that we revisit those doors. We strengthen relationships and ensure that we respond effectively to the disaster affected communities. And so preparation is the key towards that. Thank you, Siale.
Pinaka, thank you very much, Ratu Josefa. You have raised a lot of interesting point of discussions, particularly in how we have seen the AHP consortium has become a platform that bring together the local civil society that allow practicing of localization, I would say, taking place. And we have seen the right environment right now, where the lockdown, a lot of the international NGOs are not able to provide the support that they usually do to Fiji. But that has given an opportune time for our local civil society to emerge and take up a leadership role in their response. With that, I would like to take us a little bit to responses from the community at the subnational level. So I would like to invite Vani. Vani is from the DCOSIS from BA to share from a perspective of a local led community organizations such as DCOSIS to reflect on what the Ratu Josefa has been sharing in terms of how the local civil society taking up that opportunity of taking much more of a lead in the current response that we see now here in Fiji. So over to you, Vani.
Ciale, she might have dropped off in her. She's just I'm getting a message that the signal is quite weak in her area. She's trying to find a better spot.
Okay.
Yeah.
I will then take up that, ask you, Vani. Vani is the Executive Director of the Fiji Council of Social Services. I will save that questions to Vani from the DCOSs in terms of responding to, providing the perspective from a locally led NGOs at the community subnational level. But I would like to pose a question to you, Vani, from EFCO's perspective, particularly around the human rights-based approach, because we have come across a lot of challenges in terms of how we are responding to, how we are building accountability to our affected people, affected populations, that we oftentimes have to struggle with pushing for human rights-based approach, recognizing that we need to mainstream that in all the responses, in all the preparations that we do in terms of humanitarian actions. If you could share your perspective on that, Vani.
Thank you, Ciale. Perhaps I'll start just by sharing that, part of the great work that CSOs do is, because of their focus on, human rights and also in supporting the dignity of, human beings. One of the things that we have seen, particularly at this level, is how the engagement of civil society in the humanitarian space means that the commitments that they have made to inclusion and human rights is brought into this space. So a lot of the work that they do around influencing improvements in the inclusion of traditionally marginalized populations such as children, people living with disabilities, the elderly, single mothers, because of their commitment, part of the objectives of their organization, their objective to seeing a better world, and in upholding the dignity of human beings. These lenses are brought into the humanitarian space, and I guess part of why a lot of changes have taken place is because the space has already been enabled in the humanitarian space. We heard from the minister as he talked about, the act. The act in itself, I mean, it has, it's got a multi-sectoral approach. It's also embedded CSO participation in it. So that in itself has enabled CSOs to bring in sort of the experiences, the expertise, the technical capacities that often, sometimes, government usually doesn't have because of the lack of resources. So a lot of times the support that CSOs bring help us to really zero in or zoom into vulnerabilities and vulnerable groups. So in answering to that question, Ciale, this is where partnerships, not just within civil society, between INGOs and local civil society groups, as well as with government. This is where the partnerships have become really beneficial, not just for different organizations or different groups, but that goes right down to communities, that we're seeing those who have often been left out being included. And such is the framework that already exists within our humanitarian space. What's interesting about the context or the space here in Fiji is that the Act has already enabled CSO's participation and contribution. And secondly, with the humanitarian policy, bringing in the support that or the technical expertise that's available within the thematic areas. Yeah? This is through the cluster system. So in the cluster system, we have, organizations that specialize in different areas of response, from inclusion, safety and protection, to communications, for example, to WASH, to other areas, logistics. All of this allows us in our different areas of work as civil society organizations to bring this expertise, to bring the resources, and provide that support to this one system that exists at the national level. Perhaps I'll also talk about how civil society have, really embraced the national humanitarian system. You can see that in the active engagement, not just in the clusters, but, really looking also at how they're grounding their actions. And this is working through, working at the subnational level, working with commissioners, working with the PAs, working with the Rokotuis and the district officers. We're beginning to see a lot more of that. And the work that CSOs provide in this space goes beyond, activations of response and surge support, but also into research around global commitments. We talked about earlier the research work that had been done, carried out by a few organizations. I can share about how Piango has worked in this space to really track how localization is taking place. In 2020, it partnered with UNICEF and FCOS to look particularly at accountability to affected populations. And this was during the response to TC Herald. The approach that Piango took, and FCOS in that sense, was the accountability to affected populations framework, which really looked at, how did this support really reach the communities that needed it. And some of the lessons we've already started to share with government as well. CSOs, their contribution is really driven by research and data. That's part of why CSOs can add value to this national system. Also, because of our commitment to inclusion, I've already talked about this, our commitment to inclusion and human rights-based approaches. And in that sense, we often, push for better standards in humanitarian practice. I think one of the great things about the humanitarian system is that it is intentional about learning, and often after response, there's after action review workshops that's conducted at the divisional and also at the national level. So there's always that need to continuously improve, and that's I guess a trait that might not be present in other structures, and that's something that CSOs have really taken full advantage of. You might have heard about the endorsement of the National Disaster Council of the Psychosocial First Aid Manual, on Monday. And this is some of the ways in which CSOs have begun to really influence the system, but they've done it by partnering. You can't do anything by not engaging the system. You have to engage the system. I'd also like to talk about how, FCOS, given that FCOS is seeing that there's, a need to improve accountability to affected populations, our work around TCIASA has really focused on, fostering this. And this was done in the Kaunrobe, Mbua, and Maduata with the support of Child Fund through the HP consortium led by, Plan International. We're seeing that, a lot more improvements can be done in this particular aspect of humanitarian response. It's really about, and it goes right back to our objectives as civil society organization. The all important question of why do we engage in this space? So for organizations like FCOS, our involvement in this work is rooted in our vision for a better world. Our belief that, dignity is inherent in every human being. So, that compels us as NGOs to provide interventions that uphold this and, works towards a better, a more resilient Fiji, as the minister was talking about. I guess, for FCOS, the focus on accountability to affected population, and of course, with the support of Child Fund, is really, rooted in the belief that communities have solutions, and we need to be able to enable the space and the mechanisms to allow them to lead, to find those solutions and help us to add to those existing capacities. So when we find that when we go into communities that have existing capacities, or if there's a deficit for coping and remaining resilient, this is when we partner with INGOs to try and access that technical capacity support, and that's how it's worked quite well. And consortiums like Australian Humanitarian Partnerships, Piango networks, this is how it has worked in this sector. And we do this work. We know that there are still challenges in the work that we're doing to try and influence change in the system. Part of it is really sometimes, civil society have been really caught up in the project management approach. It hasn't really focused on the bigger picture, the results-based approach, where we're looking at how these different projects adds to a bigger change. That's probably where the challenge lies, is how we link up these small actions so that it can lead to a bigger change. That change is rooted in the well-being of our communities. And in saying that, to highlight perhaps and pick on what the minister had shared, which is around how sometimes we can come into this space and we compete, when really we should be focused on complementing our efforts, and that's where the challenge lies. Is in looking at the bigger picture, looking at how the little projects that we carry out add to a bigger change for the benefit of our communities, and making sure that we are approaching this with the perspective of complementing rather than competing. I think stop Siale, if that's made any sense, colleagues. Vinaka.
Thank you very much, Vani, for really comprehensive coverage of how we see the different connections, particularly around accountability to affected population. But one of the key areas that you have highlighted is that humanitarian human right based approach. It's a concept that oftentimes it's a bit hard to comprehend, but I think you have simply explained that, and I hope that others have taken note of that. The sense that we really need to zero in to recognize some of the vulnerability member of our society, that they do have different I would say challenges that they face that need to be recognized, and that's where the human rights perspective is really to recognize the diversity of our society and our people in our community, but at the same time also look specifically to some of the disability, some of their challenges that they face, either physical or mental, or it's related to the challenges of living conditions. With that, I would like to invite our two respondents. One of them is Harrison, is from the Empower Pacific, and we have had some discussions around different policies and framework that has been tools that allow the work of the partners in the humanitarian sector. But there has been some quite good examples of how partnership has helped empower Pacific and their partners in developing the first aid manual that the minister had referred to, but also the other speakers. So with that, I would like to invite Harrison to please speak to the key ideas from the influencing the humanitarian system that resonate with you in terms of looking into your experiences in pushing through the psychosocial first aid manual for the Disaster Council has just recently endorsed. Welcome, Harrison. Over to you.
Thank you so much, Emmeline. The Honorable Minister, Sir Mr. Seriratu, the Madam Director, NDMO, and Madam Director, FCOS, and our fellow local and NGO partners. Welcome and a big Mula Vinaka to you all. Briefly, I'll just explain on how Empower Pacific has been working closely with government and together with partners, HP partners in terms of the coordination, and together with with the civil society during this in times of disasters, and ways we respond in assisting to reach the communities and improving the way we deliver the services to the affected population. I'll talk a little bit on the coordinating and coordination. Empower Pacific has been working closely together with HP partners, even during this COVID-19 response. We've been working very closely with the Ministry of Health. And across this work, we also do coordinate with the provincial and district offices. And I'm sure like the HP partners, this is one area like we really rely on to have access to get into the community, and where we get in touch with the community leaders so that we have a better understanding on the type of response we can deliver and the need that is out there. So the work that we do has been very closely linked with what government and other HP partners is trying to do. And during this COVID-19 response as well, Empower Pacific has been working closely with the hospitals to provide support to those individuals and families who have been really affected because of COVID-19. We've been providing them with psychosocial support and mental health support to help them overcome with the stress that is linked with what they have learned and what they have experienced during these hard times. And also, there's also work being carried out because of the good coordination that is happening between government. We've also been able to work closely with the MOH quarantine facilities to provide mental health and psychosocial support services to those who are under these quarantine facilities. And together on that, like the work that is carried out, we also ensure that we closely work with the Department of Social Welfare in terms of referring any cases of abuse, neglect, exploitation and violence cases to the Department of Social Welfare, and they are responsible for the case managing. So in terms of referrals, this is one area like Empower Pacific, together with CSOs, HP partners, we want to closely work with government in terms of providing referrals to assist people who are in need, and providing other support as well with the RPF, Rainbow Pride Foundation. This is some work we also do within the HP partners across what we to help each partner when they need the support. For RPF, we have members who are out there who need the support of our soldiers and communities, the vulnerable communities who need psychosocial support. So this is one greater area we really need to work with. And most importantly, the coordination with the FPOS. This is very important in times of disaster, given they hold a very key position in terms of representing civil society organization as our focal point during activations. And we continue to acknowledge the progress of how things has changed from the past until now. We've seen that there's a lot of improvement in the humanitarian space, where we see this, we continue to see this a limit or support to avoid the duplication of work and improving the coordination with other CSOs. So the main important point that I'd like to illustrate is that neither the government nor civil society can go to do things alone, and that without coordination, synergies that we are in now, it cannot be realized if we have not worked together. Thank you, Emily.
Thank you very much. Thank you very much, Harrison, for sharing your experiences and the experiences of the Empower Pacific in terms of partnering with other NGOs, but also being able to push through that that manual that is very helpful in the current situation of COVID-19. And with that, I think that we also need to recognize the willingness of government to accept and to endorse some of the work of our civil society to be used as part of tools and resources, materials for enhancing our understanding and knowledge of responding to our affected populations. We are having a bit of challenges with the connections to our colleagues from BA, but also from our friends from the north. So I would like to open up the now for questions, and we have a few questions that's already being posted on the chat box. Please, if you have any questions, put it up on the chat box. If you want to ask your questions, please use the reaction facility that we had on the Zoom and raise your hand, so I can be able to direct you to ask your questions. The first question is really around communication, and this is directed to the director of NDMO. So the questions goes, how will the government now use the PFA manual as a very good example of coordinations between civil society and government? That's the first question. The second question is around how does the NDMO intend to coordinate with civil society in the future, specifically to coordinate needs assessment post-disaster? So Vasiti, if you don't mind responding to those two questions, please.
Thank you, Sarah, and thank you for the question. For the first part of the question regarding the psychological first aid training manual, I believe this is something that, as part of our humanitarian principles, is to standardize some of the work or the efforts that's happening at the community level. From TC Winston experience, our communities, some of them were inundated or overly overwhelmed with a number of organizations or individuals that were coming in to conduct training or other area of support. So lesson learned from that is to ensure that it's not repeated. And one way of that not being repeated is standardizing some of the trainings that has been taken down to the community level. And I'm grateful that the psychological first aid training manual, which will mandate those that are qualified to conduct the training to use a standard that if any disaster, irrespective of the geographical location of the disaster, if it's in Yasao, or if it's in Bonole, or if it's in Southern Lao, if training has been standardized, it allows people in the community there to identify, those critical moments where need or where assistance is needed at the community level. So that's the importance of standardizing. No matter the geographical location, it's the same message, it's the same theory, and it's the same principle being addressed right across here in Fiji. So how does that assist with the coordination? It allows information flow to be accurate. It allows information to be standard. And it also holds accountable for those who goes in the field to conduct psychological training to ensure that the manual that they're using is endorsed by government and it's been thoroughly consulted through key stakeholders or all stakeholders to ensure that it addressed the needs on the ground. And as I mentioned, the psychological training manual, first aid training manual is a product out of TC Winston lesson learned. And this is something we do every time after a cyclone or after a disaster. We conduct after action review, and the key indicators from that after action review is what paves the way for changing at any or for future response. With regards to the second question, what was the second question? The second question, I believe it was on post-disaster. If I backtrack that a bit on the initial damage assessment, we all know as first responders, when it comes to initial damage assessment, it's usually government oriented, where we're trying to move to the community as soon as possible. One is, the most important one is to identify people that have been affected. So in other words, life-saving response, identifying the roads that have been affected so that when the humanitarians or when we send the response team in, we are able to identify which road have been affected. We are able to identify the number of people that have been affected per community. And this is why initial damage assessment is government focus when we deploy. Moving on to the detailed damage assessment, this is where we are a bit more flexible. We work very closely with FCOS and Red Cross at both, even at initial damage or detailed damage assessment, to ensure that we save lives. And then the post-disaster need assessment. This is something under the National Disaster Management Act also mandated to be undertaken in an event of any given massive disaster. As of when the need arises, is when the appetite is there. The NDMO conducts post-disaster need assessment to address some of the key elements of what has been lost per each sector, so that we can come up with an estimated loss for a disaster, which will then drive what needs to be factored in when it comes to rehabilitation. Thank you, Siale.
Nakavasiti, there was one question that's following up from that questions around coordinations that I would like to. Well, that question was specifically just asked for Vani. What is FCOS's future plans to further improve coordination with NDMO?
I guess for us so far, what I'd like to acknowledge first, the political will that exists, and the fact that a law already mandates, the fact that, CSOs need to sort of coordinate, and, FCOS being the focal point, that, we've tried to work on how we can improve that. We've gotten some help with regards to development of a CSO protocol. We thought to prioritize subnational level coordination first, given that's where communities are. And we've had some great support from both NDMO as well as UN OCHA. Last year we were in the middle of, we had completed some consultations with, at the district level, but we needed to consult national NGOs and INGOs, and we had some great support from NDMO and UN OCHA to do that. We managed to convene 2 more consultations to look at that. So one of the things we are pretty happy about is the development of, that took place earlier this year, which was, the activation of a CSO coordination unit within NDMO. To me, that signaled, the I guess the seriousness by which, government is looking at civil society actors in the space, considering us a partner, I guess, in the effort. We're looking to see how, the act, because the act was under review, and, even as the minister spoke this morning or late, this afternoon, he spoke about, even just considering an all hazards and crisis management approach, and that's probably going to even further impact on the review of the act. We hope that it will, because we need a streamlined and coordinated system at the national level. So at this point, we're really just waiting on that to see how that's going to impact how we coordinate as CSOs. But as I speak, one of the things that we have coming up at the end of the month or middle of September is a Fiji CSO contingency planning. So even with, government relooking at the frameworks that guide how we do our work, it's beginning to catalyze a lot more changes even within the civil society sector. It's encouraging us to work together more closer. So, for us, it's really just trying to encourage a lot more of the coordination and the solidarity within the civil society. And if we are doing it, and if there's a framework that guides how we do that in natural disasters, we're also trying to see how that can also encompass responding to pandemics and other disasters. So I know it's in the air, but it'll have to be given how we're in the middle of a crisis right now.
Nakavani, let me try to connect to Lucy. Lucy, if you are able to connect, please.
Hi, Siale, can you hear me?
Yes.
Okay, Bula everybody, Bula Madam Executive Director of FCOS, and to you, Siale, and everyone on this panel. Just a little something from the north here. We just around the work that was carried out post DCSA with all the NGOs and CSOs, and the work that we were able to see happen on the ground. But before that, in just thinking about what the Honorable Minister said and Director NDMO, and just now with Vani and all the other speakers that have talked about the plans, activation of plans, and the Fiji CSO's contingency planning. That's something that we would really welcome, because what we saw on the ground here post DCS was something that everyone has just been talking about, the near collision or running into each other of work that was carried out by CSOs and NGOs. Please don't get me wrong, people are very grateful for all the help that was rendered. But for some places, there were a lot of the same thing happening, while there were places that barely had nothing. And another thing that we saw was that as DCOS here, because I don't know why, but there was sometimes some issues around just alerting or helping us know what they were doing or what they were going to be carrying out. And so getting secondary information about that was also an issue. And so it would be really good to just have, maybe I know that there's something in place already where people where all the NGOs and CSOs are talking. But sometimes at the ground level, this does not really happen. It does not eventuate and just makes it a bit stressful for those who are on the ground. And if I could just add, um, maybe if we could just work more around engaging local people, engaging local groups that are, doing the work, credible, and just helping people understand that there's just so much wealth out there. Custodians of the land have a lot of answers to the issues that they themselves face. The three provinces here in Level have workable structures in place. At government level, a lot of work is spearheaded by the provincial administrators and to the Matantikinas downward, and this is workable. But I think as CSOs and NGOs, we could perhaps create spaces where the heralds, those that navigate the seas, the traditional healers, the craftsmen, be consulted. And we as CSOs and NGOs not just look at them as beneficiaries, of the help that we are giving. I know that, maybe this is taking place in some areas, but as communications, as someone who's in communications and a journalist, when I go around covering stories, these are some things that constantly come up. And then because I'm also part of DCOS, and I'm sometimes in that space where, but isn't there work being done already? So, in a nutshell, after all this rambling, maybe just a more coordinated approach. And I know this is something that people have just been saying from our minister, honorable minister, right down to all the speakers, is that, a coordinated approach, because, our people here, our forefathers, we are resilient people right across the Pacific in here in Fiji. And so if we just engaged more at a local level and had a more coordinated approach among CSOs and NGOs, and maybe, we could have something more tangible happening on the ground. Otherwise, thank you for all the work that everyone is doing, and just a big appreciation from us here in the North.
Lucy, thank you for being able to connect. I know that your connections has been challenging since the beginning of the webinar, but you have brought in quite an interesting observations from the community level, where we are talking at the national level around coordinations, the importance of communications in coordinations. There is a question that has been posted on the chat that speaks really to your sharing, Lucy. But this question has been directed to the director, Madam Director of the NDMO, around. So I'll ask the director of NDMO to respond, please, and also to Ratu Josefa, because the questions is directed to both of you. It's really around how coordinations has improved since TC Winston, and I think that you have already touched based on that. But it's follow up with the questions around would you be able to share the communications not only between humanitarian actors but also with communities? And I think this is where Lucy has shared from the community. Perhaps Director Ndimo, if you could share your perspective on that particular questions before I ask Ratu Josefa to respond to.
Thank you, Siale. Again, thank you for the question. Very useful when it comes to disaster. One of the lessons learned from TC Winston is standardizing messages that goes down to the community level. Again, this is one of the reasons We supported the psychological first aid training manual, which was recently endorsed by the council. It's because of that standardization that allows people to speak the same language in the event of a disaster. The Fijian DMO is also working on the development of a community-based disaster risk training manual. Again, the key word is standardization. This is all lesson learned building on from previous disaster, ensuring that everyone speaks the same language in an event of any disaster. Further to that, we are, as alluded by Vani, we are revising our current act. We are developing a disaster volunteer manual just to ensure that it is comprehensive, that it covers all volunteers that works in the space of disaster management. And also we are looking at the disaster risk management coordination guideline. So these are a few policies or few standard operating procedures that the national office is working towards to ensure that communications is infiltrated down to the community level that are not only correct, but also replicated in other areas. So building on to the cyclone season, the National Disaster Management Office is mandated under the Act to conduct the National Disaster Awareness Week. This is when the NDMO goes full out with the commissioners, with the district officers, to get the messaging down to the community, the importance of ensuring that you put those extra nails into your homes, that you have that it is safe in an event of a disaster. The importance of what does it mean to preserve food in the event of electrical blackout. So these are key messaging when it comes to disaster preparedness, that the NDMO goes out full-fledged into the media to get it out to the community. Last year, we used all the different types of media. We also published the Build Back Better documents that were done by Habitat for Humanity. There were a few articles that we released or we supported through the Fiji Sun as well as the Fiji Times, just so that people can get hold of what it means to just put those extra nails in to have a stronger home that could withhold a strong wind for that case. As looking at the question, there's also an element of COVID-19 for NDMO when it comes to awareness. The commissioners, as COVID had a community transmission, one of the main tasks that we were assigned by the Honorable Minister to do was to do aggressive community awareness. So through the network, through the disaster structure, we used that to go down to the community. We took the flyers, the pamphlet down to the community and talked to them about the importance of COVID protocol. So through that process and also through the community awareness engagement that is across all ministries, we've managed, for the Central Division, we've managed to profile over 50,000 individuals. In the Western Division, we've managed to profile over 90,000 individuals. So these are data that tells us the campaign that we have been taking down at the community level. We take the flyers and the pamphlets from Ministry of Health, and the officials and the volunteers goes house to house and talk to people about the importance of COVID-19 protocol. So for us, community engagement and community awareness is very critical, not only because it's part of our role, but it's one of the successfulness story from previous disaster that makes a difference when it comes to saving lives. As we speak, there is a boat that's preparing to leave for Kandavu tonight. The community engagement initiative is going to be rolled out to Kandavu as well, where we'll do profiling at the community level, talk to communities about the importance of COVID-19 protocol. So the data that we are collecting is also a way forward for our disaster preparedness as we start to update the information we have at the community level and how best we can support people in an event of any given disaster. Thank you, Siane.
Vinaka Vasiti, I would like to follow up on that same conversations around the perspective of consumers of information during COVID-19. and we're still seeing miscommunications, which has led to confusion. And I would like to ask Ratu Josefa if you could share your perspective, particularly from the AHP consortium work. Have you had any work around improving communications? We have heard from the director of NDMO the importance of community engagement. Perhaps you might be able to share some of the work from the consortium relating to communications.
Actually, I'd like to align my response to the answer that the Director NDMO has just given, which is the community engagement is a critical component as part of communications. And so I believe in our first webinar, I had addressed this briefly, but I'd really like to bring this up again so I can answer the question tactfully. With the AHP partners, one of the key areas that we're focusing on is also supporting the NDMO in revising the community-based disaster risk management manual, CBDRM manual. And with that, the NDMO has identified key priority communities in Fiji, focusing in the Northern Division, Central and Eastern Division, where we are to go in and really roll out disaster risk management training at the community level. And so part of this training, Siale, is for community members who will eventually form community-based disaster risk management committees. That's quite a mouthful, but committees, right? Community-led committees. And then their ability to understand their roles and responsibility. I think that's the first area that we really need to address when looking at strengthening communications, particularly between government and non-state humanitarian actors, is to understand the roles and responsibilities at a different level. And so at the community grassroots level, through the CBDRM manual rollout and implementation, DRR, DRM trainings, this is a critical component because any Tom, Dick, or Harry that's part of the committee are able to understand what their roles and responsibility are and ensure how they link up their roles and responsibility to the DO or the PA's office. Forgive me for the acronym, the district officer or the provincial administrator's office, right? Because for any response, it is through the DO and the PA's office that provides the collected information from the ground to coordinated through the commissioner's office and then through the NDMO for them to be able to understand what is the type of response that is required at the community level. If communities do not understand this link, do not understand this structure, they tend to miss out on opportunities, opportunities in the sense of being provided with an informed response. Now, for example, if a person with disability, let's say physical impairment, lives in community X, and the assessment is carried out post-disaster and does not consider the needs of that person with disability, the information that flows up to the government chain level, at the subnational level, and the response that will be provided back to the community is missing out on the need of that particular person with disability that has physical impairment. And so communication is critical. Understanding the roles and responsibility to be able for community members to address this adequately, and also to align their needs with what is being provided at the subnational or national level. Now, linking the question back to COVID-19, we, the AHP partners, as much as possible, ensure that there's consistency in messaging. And because of that, we regularly ensure that whatever messages that we provide out there to the public is endorsed. We have the MTCCC, forgive me, and the Ministry of Health. We have the Ministry of Health as the go-to focal point. We also request support and advice from the NDMO, and then likewise other agencies such as, or rather other other agencies such as the CDAC network, and this is the Communicating with Disaster Affected Communities network. So there are support mechanisms out there that allows us to, roll out messaging that is consistent. And at the same time, what we as HP partners are keen to understand is myths, perceptions that are out there that are, that are becoming a hindrance to people accepting the information, right? Because in order for us to understand the issue, we will need to identify what the issues are for us to then be able to provide an informed response or an informed messaging. So in our line of work under the AHP, while we focus on different sectors associated with agriculture, livelihood, WASH, psychosocial support, we also ensure that communications is part of the intervention so that we collect feedback in terms of the grievance mechanism. We collect opinions, choices, so to speak, so that at least we can gauge where we are at and where the gap is and where we need to be, so that we were able to provide an intentional and an informed response. Thank you, Siale.
Inakaratu Josefa. Lucy, I hope you're still connecting. There is a question here that is requesting for Lucy to, she has been sharing the challenges that that is facing from the community. So the question is really asking from her perspective, what is the kind of structure that through civil society that should be that they feel that can work on the community on the ground, and really from her experiences as a DCOS member, how FCOS engage with the district level EOC. Lucy, if you are able to respond. Okay, so Lucy is no longer in the chat. Vani, if I could give that questions to you.
Ovinaka Siale, apologies from Lucy because she's currently in Mbua. She had to rush to where the Australian Defence Forces are still stationed to try and get a connection to tune in. So she's left. But I think based on what we've learned so far from TCIASA, when we go, into various communities, there are, different provinces, different divisions. They all have very different contexts. A good example is this, how we planned to have Lucy tune into this conversation, but because of the challenges of internet in her area, she's had to, go in and out of the meeting. Sometimes we develop this, generalized approach that we think will work across all kinds of communities. But in reality, when we get into these communities, it's completely different. What may work in the Western Division may not work in the Northern Division. And that's what we discovered when we went into the North. And we basically had to take different approaches, province to province. In the Konrove, the District Council of Social Services is working quite well. They're very well supported by the provincial administrator, the Konrove. And so when there's a cyclone or when there's call for help, they these are volunteers. They turn up to the PA's office to offer whatever support. And they've also had access to training from Save the Children, a few other organizations. But in Mbua, we had to take a different approach. We used a more traditional, we used the traditional system. We reached out even to the Turangana Tuimbua. We used a network, a youth network, to try and get into communities, to try and get that sort of community feedback, that community engagement going. And they have such great relationships at those levels with the PAs and the Rokotuis. So you really have to go at, you can't take a blanket approach, I guess, when you go into different communities. Perhaps if you're working alone in the Western Division, then that's okay. But if you're going to have a sort of a national program, then you really have to be talking to communities about what works, because if not, your program is ineffective. In Lambasa, for example, which is, the saturation of NGOs there is quite high. We looked at working more with community-based representatives or groups, because NGOs are also based out in Lambasa. For me, really, there are no blanket solutions. When you go into a community, you consult with leaders, with say, for example, the PAs, the DOs, ask them what works. If you have time, consult the district advisory councillors, consult the DCOSs about what will work, because if you want to be effective and if you want to save lives, you're going to have to do that. You're going to have to take time to consult with communities, consult with leaders in a particular organization. So I don't have any easy solution for that answer. I'll say, if you have a robust infrastructure, like they do have here in the Central Division, it's quite easy to coordinate, and blanket approaches might be able to work. But remember that this may not necessarily apply in informal settlements, which are many in the Central Division. So no blanket approaches, solutions from me, Siale, sorry.
Thank you, Vani. And I think that there has been a questions on the chat that was targeting to, well, not targeting, but was supposed to be for me to ask the director of NDMO. But I hope that the person that has asked the questions has already kind of relate to what Vani was the answers that provided by Vani. That is really speaks to the question was really to look into establishing social listening, really just listening to make sure that that what you hear from communities are being translated into a tailor-made messaging with a more responsive to specific communities. I don't want to just give the space to Vasiti to repeat herself, but I hope that the messages that was given out by Vani is that each of our different communities work in a totally different way. Some are using their traditional systems, some are using the local government, provincial offices, but really the message that comes out strongly is that you really have to look deeper into that. And hopefully with the profiling exercise that the NDMO is currently doing, that will bring out some of those evidence and information that can help humanitarian actors to develop and design their program that can fit, as Vani had said. You cannot just use a one size fit all to a people of Fiji that is just so diverse. I would like to invite Harrison.
Sorry, Sally, can I just add to that, just to share that FCOS has a community observation template that we ask our DCOSs to fill out every day. It mirrors what is in the humanitarian system, which is when communities send in their observations, they are observing across the 9 thematic clusters, the humanitarian clusters. And it's really voluntary. It's only when communities see the need and they send in reports. We collate this and we send this to on a daily basis. We don't do it in the weekends, but we do it during the weekdays and send this to NDMO. We send it to the commissioners. We send it to the Commissioner of Police, and just recently have started sharing this with the Ministry of Health. to help with the COVID-19 response. It's almost like putting your ear to the ground and just getting from communities how, rollouts by, government support, even CSO support is impacting at community levels. Thank you, Siale.
Nakavani, we are coming around to the last part of our webinar, but before a 1-minute wrap up, I would like to invite Harrison, if you are still here, just to contribute again to the conversations around community engagement that we have now seen and excited about the different manuals, different policies, different legislations that are already in place. Now that the next step, I suppose, is to make sure that those tools are helping us better inform our community in terms of response. Perhaps you can share your experience from the Empower Pacifica, Harrison, around engaging with your constituencies and people that you work with, and what kind of system and mechanism that you find that it's working.
Thank you, Siale. First and foremost, yes, something I missed out on the PFA manual. This is something like I would do what the Madam Director has mentioned, something that we want to see that there's some standard of service delivery offering to the community. And we also ensure that they're getting the same level of support. And what we're also talking is all the same when we are using the same tool in terms of delivering our response to the communities. Just on the community engagement, yes, this is something that we've, as a CSO, we realize the importance of engaging community in the every level of discussion, whether it's with dialogue or engagement in the communities, to see that their needs is properly communicated. Again, it comes to the way we communicate and report the level of the need that they really require into the channel of communication that is in place, and to really ensure that communities are really working together as well in terms of us ensuring the resilience, to see that persons with disabilities, the vulnerable groups, so just community, persons with disability, the single mothers, these are the most vulnerable people, and even children who are mostly affected during disasters. It's very important that we really attend to their needs at first at hand while we are getting into the communities, to see that they receive the most appropriate support at that time. We see that engaging with community cannot work unless if we work together with the government through our focal point of contact, our TCOS network. This is to ensure that we have proper access to getting into the community level, as this will also improve the coordination, and we are also able to meet the people's needs. Inaka
Harrison, may I ask the speaker 1 minute each, just a last comment or reflections in terms of how you see these conversations moving forward. Vasiti, please.
Thank you, Siale. Again, on behalf of the Honorable Minister, our Permanent Secretary, and the whole of the commissioners and the whole of the National Disaster Management Council, together with the National Disaster Management Office, I would like to convey sincere appreciation for the team putting together this webinar. We've also taken into account some of the comments that are coming in, some of the comments that were alluded by the speakers, and as alluded by the Honorable Minister, we can only improve on what we've done from before, and it's webinars such as this that will make a difference in our upcoming response. Again, please adhere to COVID-19 protocols, ensure that your communities are vaccinated, and most importantly, continue to watch this space as we build towards disaster preparedness and as we build towards the new cyclone season. Cyclone season will be released next month by the Fiji Met Office. Once that is out in the media, I will ask that we re-strategize how best the humanitarian partners can work with us to ensure that the communities are well prepared for the upcoming cyclone season. With that being said, and a blessed day.
Pinaka, Director of NDMO, thank you very much for that, and thank you for staying with us throughout the webinar. Over to you, Ratu Josefa, your last reflection, please.
Right. Thank you for the opportunity. It's really an eye-opening opportunity to hear from the respective panelists, and then likewise the question posed by the respective audience. And so within concluding remarks, COVID-19 pandemic has shifted the goalposts at the humanitarian level. On one end of the scale, it has allowed us to strengthen our coordination and preparedness, while at the other end of the scale, it has prompted us to ask whether we as NGOs are better equipped, to better serve the affected communities without putting our organization, our staff, ourselves and our families at risk. And so in my discussions with colleagues, we would ask ourselves, how has COVID-19 impacted us today? And now I'd like to rephrase that and then ask the audience, how have you made an impact in 2021 dealing with COVID-19?
Nakaratu Josefa, and there's a very powerful message. It's about time that we ask ourselves, what do we need to do to change the change that we want to see, and how we can take that lead. I have to ask one of our partner, Michael, if you are in the room, just to say a few words as part of the. Michael has been working tirelessly from behind the scene, but he has been a part of our partners that has hosted this series of webinar. Over to you, Michael.
Thanks so much, Siali, and thanks to everybody who has come online to join us, not just on this webinar, but on the first webinar as well. We have had many repeat customers, so to speak. So again, I think we've got a bit of cross communication there. So yeah, for those who have participated in this one, but particularly both of the webinars, thank you very much. I think, as I've just written to Josefa on the chat, I think both webinars have been very fruitful, particularly this one. With this one, we've moved from the theoretical and the abstract, as perceived by many people with localization, to something that's a touch more concrete. So very positive outcomes. I'd like to thank the NDMO for their contribution, of course, the Minister for their contribution, and all of our civil society partners for investing their time in what's been, I think, a really positive initiative. So back over to you, Siali.
Thank you, Michael. The last reflections, over to you, Vani, for your 1 minute reflection.
Naka, Siale, and just wanted to take this opportunity to thank the Minister, Mr. Seruratu, and of course the Director, NDMO. I think part of why we can work in this space is because we have leaders who believe in the work that we do, and so that enables a lot of the change that we want to see, so that communities can really continue to remain resilient and that their well-being are protected. Just the last two messages from me is to just reinforce what the minister has shared at the beginning. We now have to think about because there is a need to change the way we do development. Many of us are used to doing siloed approaches, project to project. We really have to come out of those boxes, those silos, and to really look at things from, look at the bigger picture and see how our work is helping to contribute to that bigger goal of seeing, people that are well and are living in dignity. The other bit is the way we do partnership. And I think this webinar or the series has been a good demonstration of how partnership should be done, opening ourselves up to, critique so that we can improve ourselves. And that's a partnership that's rooted in anything else is not going to work. But I think that one that allows us to work together, but also to come back to see whether we are actually achieving what we had set out to do, how are we impacting on communities. I think that's the sort of partnership that we should work on. So those two messages for me were are my takeaway, and probably something I might want to reemphasize at this point. Thank you very much, Siani.
Nakawani, and that brings us to the end of our webinar. I would like to finish off by my takeaway, and that's really what the Honorable Minister had shared, that we find that in any situation of crisis, there is always that opportunity to shift our focus to a more transformational agenda. And I think this is the opportunity of our webinar, reflecting on the different scenarios that we had been operating in. But what I have seen in response to the questions and the sharings and the reflections, providing different perspective, that there's a lot of goodwill, both from the government, civil society, international partners, and I hope that that will trigger a lot of goodwill continue in engaging with our community. With that, I would like to thank everyone for joining in. Thank the Minister, the Director of NDMO, Raju Joseph, always been part of this work. Michael, Harrison, Lucy, and the other Vani who is not able to join in, but also Vani from FCOS and their team, as well as Piango and our team and our network, and everyone from our civil society and across the region who have joined us here in Fiji online. Winaka wakalevu, and take care, stay safe. Ofato.